Welcome to Socialpost Health Channel viewers. I am Dr. Chava Anjaneyulu, Chief ENT Surgeon and Chairman for Asian ENT Care Center located in Panjagutta, Hyderabad. Crooked nose deformity. This is external deformity and cause stress to the patient because face appearance is very important to anyone, because anybody they see first the face, that also mainly know the nose. If any person has nasal deformity, either crooked nose, saddle nose, they feel depressed, they want to correct as early as possible, especially with the cleft lip and cleft palate children. Nowadays many times we are correcting that nasal deformity after correction of the cleft lip and palate and while correcting the cleft lip. Crooked nose deformity may be most of the times due to trauma. They may have trauma while playing or in road traffic accidents or injuries in work atmosphere. In crooked nose, basically the external nasal bones and cartilaginous framework will deviate. But in many patients along with the crooked nose, they will have septal deviation. That we call it as a deviated nasal septum. If the patient has deviated nasal septum and a crooked nose, they will have definitely nasal symptoms, that is nasal obstruction and recurrent cold attacks. Because of the deviated nasal septum, the cold attacks are more and the cold attacks will not come down immediately as in normal people. When to get the treatment is important in the crooked nose deformity, especially if there is a deviated nasal septum which is causing nasal obstruction and recurrent cold along with the crooked nose. We can correct both after 8 years. Otherwise you correct the septal deformity at the time and you correct that cosmetic crooked nose after 14-15 years of age. The common usually recommended age for crooked nasal deformity is in females after 14-15 years, in boys after 16-17 years. So crooked nose, if patient don't have symptoms, only mild crooked deformity, you correct after 15 years. But if there is a severe crooked deformity, child is having psychological disturbances, especially not meeting with the people, not going to the school, not performing well education, because of the thinking about the crooked nose and appearance, you can correct early even after 8-9 years of the age. You see the face and bone growth and nose growth and you correct it, but preferably correct after 15 years of the age. This nasal deformity, if you correct after that, by the time facial growth becomes normal after 12-13 years. So your correction will suit the facial appearance of the child. In adults you can do at any time. Usually in crooked nasal deformity due to trauma, we correct immediately. Usually within 3 to 4 days swelling subside, we know the shape of the, so you can correct easily by reducing the fracture and the correction of the deformity. So traumatic fractures you can correct irrespective of the age immediately after the nose swelling subside. But if it is a chronic crooked nasal deformity, you correct after 15 years of the age. If the patient is having severe sinusitis, recurrent sinus attacks, adenoid hypertrophy, one side turbinate hypertrophy along with the deviated nasal septum, you do in children adenoidectomy, turbinoplasty and septoplasty. Later you can perform the crooked nose deformity correction. In adults, you correct both crooked nose, other nasal problems at the same sitting. If any problem of the deviated nasal septum or crooked nose deformity with external appearance problem, contact Asian ENT Care Center located in Panjagutta, Hyderabad. For further updates, subscribe Socialpost Health Channel, YouTube.